Now we want to get to the latest on the COVID pandemic. We are going in the wrong direction. In fact, today, the state released its COVID numbers and 3,393 cases were reported overnight. For perspective, the last time we had 3,000 daily cases was back in February. Hospitalizations are also up with 147 patients admitted just in the last 24 hours. COVID patients, we're told, are occupying just over 4% of the hospital beds in the state.
Our senior health correspondent, Monica Robbins, joins us now. Monica, good afternoon to you. You look at those numbers and you watch the growth. It's disturbing, and I'm guessing the Delta variant is to blame here.
Yeah, of course. It's the Delta variant. All of this is because of Delta, and it's mainly affecting the unvaccinated. And if we look around the country at places that are being overwhelmed, we first see a jump in adult cases and hospitalizations. Then we see the same in kids. Right now, Rainbow is full of kids with RSV, a respiratory illness we typically don't see until late fall or winter. Hospitals nationwide are dealing with this. The concern, there's no room for more kids if Delta becomes a bigger issue. Doctors on the front lines are adamant that we all need to protect the most vulnerable. If they can't be vaccinated, a mask is the next best thing.
We have to protect the vulnerable population until they can be vaccinated. It is our moral obligation as human beings to protect our children. Every person in this state should wear a mask at all times when they are outside their home.
Boy, she can't be more plain than that. Dr. Edwards says we have the data that masks work in reducing transmission in the classroom from last year. So that's the best place to start, which is exactly what the Ohio Department of Health and the CDC recommend. But her concern is this variant is so contagious, she hopes that will be enough. Regardless, she expects to see an upswing in cases in the next few weeks after kids return to school, but she hopes she will not be seeing any of them in her ICU.
Yeah, it's scary stuff, but I think a lot of parents are questioning this and talking about this. You know, should my kids mask, should they not? Also, is the Delta variant more dangerous for kids?
You know, according to the American Association of Pediatrics, about 1% of kids who get COVID get hospitalized, and at least 350 kids died nationwide, 7 in Ohio. However, with Delta surging, the age of the hospitalized is starting to skew younger. And according to the CDC, between July 31st and August 6th, children with COVID were being hospitalized every day nationwide. That's nearly matching 217 daily admissions during the pandemic peak in early January. In Ohio, we've seen our child cases jump since June. We've had more than 2,400 cases in the first 2 weeks of August. So far, though, fortunately, and let's hope it stays this way, we don't have a lot of pediatric COVID cases right now in our local hospitals.
Let's hope it stays that way. A quick clarification. We heard the doctor say if you're outside your home, does that mean if we're outdoors too?
You know what? I think every situation is different. We know if you're going to be in crowded conditions, yeah, it's just a good idea, especially if you're not vaccinated or you have somebody at home who can't be vaccinated like a child.
Sure.
But otherwise, yeah, outdoors we know the transmission was a lot easier. But again, she goes on to say this variant is more contagious than anything they've ever seen. And she told me, she goes, you just don't understand how contagious this is.
Yeah, it must be because these numbers are ramping up
Yeah.
dangerously fast.
Yeah.
Monica, thanks.
Sure.